And we're live. Hello, tribers. Let me just quickly check if we are visible in tribe. If anybody can see us, please let me know in the comments. Yes, we are very much visible in tribe. Okay. So, without any further ado, let's begin with today's session. If you can see me, let me know in the comments. If you can hear us well, please let me know in the comments. Today's session is going to be something that tribers have demanded a lot. The topic for today's session is diabetes in kids and how to control it. And for this session, we have with us Dr. Esha Gupta. Dr. Esha is a pediatrician and a specialist in pediatric intensive care with over 7 years of experience. Dr. Esha Gupta is a dedicated and compassionate clinician with a vast experience of treating sick children requiring critical care management. She is well known for her compassionate care and committed treatment technique that leads to quality of life and happiness in children and their families. She is well updated with the latest developments in the field of pediatrics and pediatric intensive care. She is awarded with the member of National Academy of Medical Sciences. Welcome to the session, doctor.
Welcome, Dr. Shweta. Thank you for having me here.
Any opening thoughts for the session, doctor?
First of all, I would like to thank you for inviting me here for the topic of diabetes in children. I'm glad I could share some awareness through this topic. This topic is particularly important now because we are seeing that diabetes in kids, especially type 2 diabetes, which is mostly related to lifestyle, is on a rise in kids. Initially, the diabetes type 2 was seen mainly in adults, but these days it's very commonly seen in kids. So, what can we do to the part to control the increase of the rise of diabetes in kids? So, I'm here to talk about that.
Right, great. Okay, so let's dive right into the first question. Let me just tell all our tribers that we have a goodie waiting for you. So, one value added comment in this live session will get one goodie from SuperBottoms. So, go ahead and do not hesitate to ask us your questions. Please let us know what you want to know about today's topic. So, let's dive into our first question, which is what are the common types of diabetes in children and how do they differ in terms of management?
So, what is diabetes? Diabetes is a group of diseases which causes increase in the blood glucose level. Diabetes is of two type 1 diabetes and type 2 diabetes. So, type 1 diabetes, which accounts for almost 10% of all the cases, it is autoimmune in nature. What does autoimmunity mean? It means our body's immune system is killing the cells of the pancreas, which makes the insulin in the body. So, this is normally seen in kids with younger age group and young adults. It normally has acute onset and children present with very high blood sugar levels. This is the condition because the cells completely kill the pancreatic cells producing insulin. So there is a complete deficiency of insulin. The management of this type of diabetes mainly requires insulin injections, which is given through subcutaneous route. And that's how the body gets the insulin from outside because it cannot make its own insulin at all. The second type of insulin is diabetes mellitus type 2. This is the most common one. Almost 90% of the people having diabetes have diabetes mellitus type 2. Now, this is the type of diabetes which is mainly caused of two reasons. 40% is because of genetics. If any child's mother or father may have diabetes, the child becomes more prone to develop this diabetes, but it's only 40% of the cause. The other 60% is lifestyle. So if the child is obese, having sedentary lifestyle, is having a lot of carbohydrate containing food, they are more prone to develop this diabetes. So type 2 diabetes, in which the insulin is either resistant, it is not working well, or it is not produced in the normal quantity, which is causing the diabetes. Now, insulin is a hormone which is very important in our body. So our cells in the body need energy to function, and the energy comes through food. And insulin is that key that gives the energy from the blood into the cells. But if the insulin is not working, either in type 1, where it is killed by the body's immunity, or by type 2, where it becomes resistance or the sensitivity becomes less, then the diabetes happens. What is important is we have to look out for what features the child will present with when they come up with these diabetes. So the child may have increased urination, increased thirst, excessive hunger. The child would be very tired. The child would be moody. The child would have frequent infections, probably more of fungal infections. The child would have very low energy, would have poor wound healing. Sometimes they can present with nausea, vomiting, abdominal pain, and even blurred vision. Children with type 2 diabetes are normally managed with lifestyle modification and diet control. Yes, if it is not managed by these methods, then they might also require oral medicines, or they may require insulin as well.
Great. Okay. And can you explain the importance of early detection and diagnosis of diabetes in kids?
So it's very important to diagnose as early as possible, because the more aware we are about the symptoms, it helps us to be more proactive about our health. The earlier we diagnose diabetes, we prevent it causing serious infections or hospitalizations, and it also improves the quality of life. If parents are well aware about the symptoms that I just mentioned, if they see any of these symptoms, more than one, they should immediately contact their pediatrician to know more and to rule out if the child is having any serious problems related to diabetes.
And how early would that be? Like, at what age do you consider that this amount of urination is too frequent, or this amount of hunger is too much, or more than
Yeah.
normal?
Yeah, so normally there is no age criteria. It can present as early as in a 1 month or a 2 month old child, and in adolescence as well. But if the mother notices that the child is behaving unusual, if the child was passing urine probably 7 times in a day and is now passing urine 10 to 15 times in a day, how much ever food the mother is trying to give, but the child is absolutely hungry, he has a voracious diet, the child is extremely irritable, and there is a change in weight, the child is losing weight, or sometimes the baby's breath smells little fruity, the baby is having frequent infections. So these are the red alert signs that the parent should be looking in kid to rule out any infections, and they should be taking the child to their pediatrician.
Okay, okay. So in the comments, we already have a viewer's question. We have
Yes.
diabetes in genetics. My father had diabetes. I am pre-diabetic. How do I
Yeah.
prevent my child from having diabetes?
Yeah. So this is a very common question. We have parents who are diabetics, and this is the question we ask ourselves: how can we control it? So, as I said, there is some part of our genetics which that we cannot control. We don't have control on it at all. What we can control is the lifestyle part of the diabetes. What we can see to it that our BMI is within the normal limit. We are not in the obesity level. We are not leading a sedentary lifestyle. We are physically active, and we incorporate a lot of fibers in our diet. Kids or parents who feel their parents are suffering from diabetes and they want to avoid or probably delay the onset age of diabetes, they should be extremely cautious about the diet they are taking. They should use sugar in moderate level. High physical activity is advisable, high fiber diet is advisable, and they can go for routine screening of blood sugar just to rule out diabetes. These are the few ways we can control diabetes if we have a genetic correlation. Yes, certain part of genetics is not in our hand, but the lifestyle part is definitely in our hand. Dr. Shweta, I can't hear you.
Sorry, I was on mute. There's a lot of
Yeah.
disturbance, so I just kept myself
Yeah.
on mute.
Yeah.
Is there any specific food you suggest for high fiber for kids?
Yes.
Because as it is, it's always a struggle for parents to make their kids eat healthy. Plus, incorporating a lot of fiber in it. Could you please share some tips on that?
Yeah, so this is very important. We as adults know what is good for our health and what is not. A kid might not understand that. They might not understand the importance of good nutrition. So it becomes the role of parents and family members to incorporate good, healthy nutrition in the diet. So few points I would like to make before I go on what foods I would generally recommend for a high fiber diet. It's important to incorporate a few habits in our daily dietary management. They would be, it's important to cook meal together as a family, have meal as a family, sitting together on the table, and everyone should have meal at the same time. It should not be that the mother is running behind the child and the baby is running and watching TV, it's on in front of the screen and having the food. Everyone should have the meal together. If a child is obese or is falling in a pre-diabetic level, they can decrease the portion sizes. It's always advisable to the parents to talk about the food to the kids, telling them what is good and what is bad, how incorporating healthy meals and healthy vegetables in the food is beneficial for all of them. The parents themselves should also have the food, because the kid will feel, I'm being given all the vegetables and mama is not having it, so he might feel, no, this is not correct. So everybody should be having it. Meal time should be fixed. While snacking, we should use healthy alternatives to snacking, like instead of cookies and bread jam and chocolates and chips, we can snack on dry fruits, steamed or boiled vegetables. Soups are a good option. Oats are a good option. Coming to your question, what are fruits and what are food items which are high in fiber? I would suggest oats, uh, green leafy vegetables like broccoli, you have lentils, you have nuts and seeds, as I mentioned, dry fruits, you have coconut, which is high in fiber. Uh, any green leafy vegetable is extremely good in a high content of fiber. They help in easy digestion. The motions are good. It is easily digested. It has enormous health benefits. Most of the fibers are easily available in our kitchen, so we don't have to go to a supermarket looking for what fibrous food or high fiber diet I can opt. Instead, try to opt anything which is in a natural source. Don't go for biscuits which are saying which is high in fiber, or packaged food or cereals which are saying that they are high in fiber. They might say that they might actually have very low fiber content. Broccolis, corn, blackberries, jamun, they are all extremely, apples, guavas, they are all extremely good sources of fibers.
Right. Okay. The next question is, if a kid has dark patches on neck, underarms, elbow, knees, knuckles, is it
Yeah.
related to diabetes?
Yes, this can be. This is a condition which is known as acanthosis nigrans, which is seen in, you can say it's a pre-diabetic diabetic condition where there is increased chances of fungal infections that are seen in patients with diabetes. So yes, this discoloration should be addressed, and the child should be taken to a pediatrician, because the parents would be applying local ointments or creams and moisturizers, and it might not help. What the child would really need is a complete evaluation from a pediatrician, checking the blood sugar levels and managing the blood sugar levels, reducing weight if the child is on the obesity side, and managing diabetes if the child has been diagnosed with diabetes.
Okay. Is craving of more sweets in kids can be a symptom as diabetes is in family? Should I make sure to my baby away from my Okay, should I make sure to keep my baby away from sweets?
So this is also a very good question. Kids would like to have sweet. Okay. What is important is moderation. And can we substitute those chocolates and cookies to a natural containing sweet form? I think yes. The answer is yes. Uh, Dates, jaggeries, raisins, they are extremely sweet, extremely tasty, and also have a lot of macro and micronutrients. They are also high in fiber. So if the child is craving sweet, definitely it has to be under moderation. You cannot, probably, if the child is normal and not in the diabetic range, of course sweets can be given, but under moderation. But it is always advisable to give the natural containing sweets which is available in nature, as I mentioned about dates, jaggeries, raisins, all these dry fruits and nuts. Figs are also sweet. One thing that I would like to say, we are the ones as adults to introduce a lot of sweets to our kids. It's always advisable to try to delay whatever introduction of food we are trying to give to the kids. It becomes a habit. As an adult, we try to praise our kids in the form of sweets. food. Okay, wow, you've done this painting, I'll give you a chocolate. Or you've come first in the class, I'll give you a packet of cookies. Or you won the race, I'll buy you a packet of chips. I think we should limit our praises in good motivating words and supporting words, instead of trying to showcase our love in the form of sweets. Because yes, sweets do have a lot of negative impact on the child's health. Of course, sweet is made that we crave for it. So once, if the child will have a bar of chocolate, he would definitely want to have it again. And it's very difficult to make them understand that no, it's moderation and we cannot give it to you again. So first, try to delay all these items. Don't try to introduce these foods to the kid at the earliest age. And even if they are, it should be very it should be modernized. It should be that probably you'll be having one bar of chocolate in a day, and switching to natural alternatives is always the best form. There are various dry fruits which are coming. All the fruits which are sweet are coming in a dried version. We can try that. That is also better than giving chocolates. Of course, as much as possible, try to avoid chocolates.
Okay. During pregnancy, I had PCOS with pre-diabetes. Do I need to be cautious for my kid who's 3 years old now? He is hyperactive and has a normal diet.
Yeah. So, what entity we are talking about here is called as gestational diabetes, and it's also seen along with PCOS. So, mothers who have had gestational diabetes, or who've had a hormonal problem like PCOS, their kids are a little more prone to developing diabetes. What can be done for this kid is dietary management from the very beginning. Lifestyle. So the child should be taken out. These days, the children are very prone to opening their laptops or their cell phones, and they are also watching reels, and they are watching YouTube videos, and they are not enjoying the act of going out and playing, going in the park, going in the garden. They prefer watching their screens. So what I would advise to this specific kid is that the physical activity should be very good. The child should be involved in household work. So that the child is more physically active. The child should be encouraged to be a part in the sports team. The child can be encouraged to participate in swimming, dancing, skating, various kinds of sports activities. The child's BMI should be monitored, so that the child has normal BMI. The child's diet, again, as I mentioned, type 2 diabetes is lifestyle dependent, so the diet is in our hands. We should see to it the child is getting high fiber diet. Cut down on sugary sodas, juices. Instead, the child can have soups of boiled vegetables like beetroot, carrots, tomatoes, water, coconut water, but avoid all these soda juices. Give cut fruits instead of making fruit juices for the child. Cut down on sugar and good physical activity. I think these two are very important in a child whose mother has had gestational diabetes. There's no need to panic. The only need is to be cautious and to be letting the child go out and play, where the child can have good physical activity, and managing their diet well.
Okay. Should we avoid to give sugar to kids below age of 1 year?
So there is no strict recommendation that says sugar should be avoided, but yes, parents do try to avoid giving sugar to kids less than 1 year of age, and I would also go by the same, because children till 6 years, 6 months of life, they only have breast milk, which has good amount of lactose, which is naturally sweet. After that, children are introduced to complementary food after 6 months. Cow's milk is only introduced after 1 year, and even sugar should be introduced by 1 year of age. So I would advise that delaying the introduction of sugar is a good idea.
My kid is hyperactive and he always cries for candies and cookies. I'm trying hard, but still, can I use jaggery instead of sugar to make sweet for my kid?
Yes, as I already mentioned this, uh, we all have sweet cravings. That's not wrong. What is important is using that in minimal level possible. Using jaggery is a good alternative. She can also try raisins. She can also try other dry fruits. Uh, Jaggery is a very good option. In fact, it has good source of iron, so there is no harm in that. What is important, and after consuming any sweet food, it's important to gargle the mouth so that there is no residue in the tooth that causes tooth cavities. jaggery, raisins, dry fruits, they are all extremely good alternative for sugar and instead of candies.
If the child is obese and one of the parent is diabetic, is there any chance of getting early diabetes?
Yes, as I said, obesity itself is an independent risk to get diabetes. And the second risk becomes that the parent is also diabetic. So, such child has to be extremely cautious. What symptoms I mentioned in the start of the program, the parents have to look if the child is having any of these symptoms. They have to be on a diet where the child starts losing weight. It's recommended, it is, the studies have proven that if you exercise 30 minutes in a day, it reduces of chances of getting diabetes by 25%. So this child would not be in the level of getting diabetes if his weight is normalized. For a kid to lose weight, it's not really, they cannot go to the gym. Again, just inculcating healthy habits of walking, brisk walking, playing outside. Parents should include sports activities or playing with the kids, and managing diet will help this child. Especially when the child is obese, it's always advisable to have a weight check, have a growth chart recorded by your pediatrician. And if any of these symptoms are noticed on the children, then the mother should immediately go and refer to a pediatrician.
Right. So, doctor, is there any safe limit for sugar that kids can consume every day? Recently, we've all right. How much sugar can a kid consume in a day?
What I would say is, see, there are you're not supposed to have nobody should have added sugar. Sugar is used in tea, in a cup of milk, that should be okay. Okay, what is important to know is sugar is definitely a culprit. Along with it, we have other culprits like whites, which is carbohydrate, which is white bread, white pasta, fatty food, very oily or very spicy food, fried foods, junk food. So let's not just criminalize sugar. Of course, sugar has to be modernized. I'm not saying that if a child is having a cup of milk with sugar, the child can definitely go ahead. What he can cut down is on these external sources of candies. Do you know what? A soda has a lot more content of sugar that we would actually imagine. These juices, which are available in a packaged form, we might not know. We might think we are drinking a healthy glass juice in the morning, but it is also, giving you a lot of sugar. So one thing which is very important is reading the labels. So many food or many drinks, we might not think they have a lot more sugar content than we actually anticipate. So reading labels becomes very important. I'm not trying to tell you to eliminate sugar from the daily food that we have, a little bit of 1 tablespoon of sugar that we're having with curd or we're having with the milk or the tea. Try to avoid fruit juices, try to avoid sodas, try to avoid sugary syrups, jams. Also try to avoid white breads, excessive use of white pastas, and a lot of junk and oily food. This together will help us fight diabetes better than just cutting down the sugar.
All right. Any points, doctor, that we have missed according to you that should have been covered?
Yeah. So, as I told you, the diabetes is on the rise, and parents are extremely worried every time that my kid is not eating. Most of the parents I see daily will tell me that, doctor, my kid is not eating. So, it's important for us to know that the child might should not be healthy. Does not mean that child should be eating all the time. A healthy child is growing healthy, is playful, is good intellectually, is active. This is all a sign of a healthy child. We as parents and adults have to provide well balanced diet to the kid. It's extremely important that we include a big bowl of salad before starting a meal, a big bowl of soup, reducing the whites that we mentioned, providing high fiber diet, good fats. Avocados are a source of good fat, peanut butter, a good nutrition in a child, and the child may not require any multivitamins or supplements. It's also important to inculcate good sleep hygiene in the child. The child should be getting 6 to 8 hours of sleep in a day. During childhood, the brain and the memory develops when the child is sleeping. So uninterrupted sleep of 6 to 8 hours at night, a good sleep hygiene where the child sleeps on time, is not using screen 1 hour before sleeping, and younger kids who are less than 5 years of age should be sleeping at least 1 or 2 hours during the day as well. Good hydration is also very important. It's also important to drink 6 to 8 cups of water for the kids, avoiding fruit juices. It's important that the child is motivated for a healthy lifestyle. So, we are what we eat. If we concentrate on good nutrients, good sleep, positive outlook, and being well hydrated, we can together manage the lifestyle component of diabetes.
Wonderful. Thank you so much for shedding light on so many important aspects of it because, as you said, it's not just the sugars, but we also have to cut out on so many other factors that might be
Yes.
contributing towards diabetes.
Yes.
Thank you so much for busting so many myths and shedding light on all these factors.
Thank you,
Thank you
Shweta.
for thank you for taking out your precious time and being with us here today.
I'm glad to be here. Thank you for inviting me.
Thank you so much, Tribers, for tuning in. With that, it's a wrap on today's session. For more such interesting sessions, stay tuned to Parent Tribe by SuperBottoms. Thank you so much.